So my main role and responsibility is to educate clinicians. So not really educating patients in my current role. I will say there are clinical educator roles out there within the pharma space that do educate patients as well, but the specific team that I work on focuses solely on the education of clinicians. So that being, it can be providers, APPs, nurses, pharmacists, pharm techs, medical assistants, really anybody in an oncology office, a cancer clinic that will touch a patient that is on one of our breast cancer medicines. So that's really my job, is to ensure that those clinicians themselves feel confident, they understand the information, they understand how to manage, say, side effects that a patient may experience while on our specific breast cancer medicines. And when you ask about the day-to-day, I will say that highly varies. And I know that can be intimidating to some people, and it was a little, I guess, intimidating to me at first, because especially coming directly from the bedside, direct patient care, that I was used to structure. I was used to even just having 10 other nurses I was working side by side with on a 36-bed unit. We had a manager, like everybody else was circulating. So then going from that and having a lot of structure, even though obviously when you're in the hospital, there's a lot of uncertainty, a lot of adaptability that's needed from nurses. But at the same time, a lot of it is structured. You'll come in at the same time every day. You'll end up leaving after your 12 and a half, 13-hour shift. So coming into now working primarily either from home, my role is considered to be a field role. So I cover geography. My geography being, I describe it as Eastern Pennsylvania, from like Lancaster up to Scranton down to Philadelphia, and then about 95% of New Jersey. So I live kind of smack dab in the middle of that territory, so I can easily drive to all the accounts that I cover. Again, my day-to-day can look very different. One day I could be providing lunch to an office and the staff in there and providing education. I'll bring in food, people come in groups, and then I provide them education about our breast cancer medicine. Or maybe the next day I don't have anything scheduled. So I decide to hop in the car and go drive to some of my accounts that I haven't seen in a while and want to just stop in, say hi, see how things are going, if there are any issues with the patients they may have on our medicines. And then another day I might work primarily from home and not really leave my apartment and do a lot of administrative stuff. Or maybe I'll make a few phone calls and try to schedule appointments for the near future. So in that sense, our day-to-day in this role is very flexible, and I do really enjoy that aspect.